We recently dealt with the issue of electronic smoking devices in Corte Madera, and after careful review with town staff, the council unanimously decided to treat them exactly the same way we treat tobacco products. So that means in terms of how they're sold, who they're sold to, when they can be used, where they can be used, the treatment for us is identical. So that applies to retail outlets, public usage in restaurants, outdoor facilities such as our parks, as well as multi-unit housing, where we have recently banned the use of cigarettes as well as electronic smoking devices. As far as we believe that treating it is the same way as we treat tobacco in our ordinance is important because we think it's a public health issue. The way these electronic smoking devices are being marketed is they're being marketed squarely at youth. They're being used as training wheels for people to start smoking cigarettes. That's how they're being sold. And it's very similar to what we've seen happen in the alcohol beverage industry, where they have a product often called Alka-Pops, which are high alcohol, high sugar, very easy to drink beverages sold in cans right in the front of convenience stores. And they are clearly, again, targeted at youth. One of the other roles I serve within the town is I'm one of the co-chairs of the Twin Cities Coalition for Healthy Youth, and we have spent a lot of time in the last 2 years addressing that issue as well. And we see this as a very similar issue. It's large companies trying to market products squarely at youth.
When we were discussing this in the Corte Madera Town Council meeting, I could see that there was reluctance on part of some councilors to be too far ahead. Well, my message is don't be too far behind, because big tobacco is way ahead of us.
The day of our hearing, we received an enormous amount of emails protesting the regulating of the e-cigarettes. And I had a little time on my hands, and people did leave their full names. And so with the help of Google, I looked up the sender of every one of my emails, only to find that none of them were local, and one of them was from out of state, and it was either Arizona or New Mexico, who actually ran some sort of distributor or factory or something that represented the e-cigarettes. But we didn't have that opinion expressed at all from our residents. So it was reassuring to know, at least with the deluge of emails that we received, that the protests didn't come from our local residents. It's very important that when you are about to make a decision on the regulation of e-cigarettes, that you do your due diligence to find out where the sources are of the information that you're getting. The FDA has great information. Also, if you go to UCSF, Dr. Stan Glantz, who is a professor of UCSF School of Medicine, has come out with the statistics that they aren't of any good, and that the particles that are emitted through the smoking of e-cigarettes are toxic. And so it is really a difficult thing when you hear a large group that you're unaware of that is speaking in favor of e-cigarettes to really know what point of view they are coming from.
One of the concerns that is at least before the fire service, and I think most health agencies right now, are those associated with electronic cigarettes. And there's still a lot of testing, but some of the early reports are alarming. And whether they be from something associated with how the e-cigarettes are powered, or whether not as how they're used, and maybe the effect that they have on people. There appears to be much more negative than I hear positive. And so I did read some preliminary work that's being done by several fire agencies that not completed the studies yet, but associated with both toxicology and fire risk. you'll find that fire officials are going to be studying this closely in the coming months and trying to make some determinations to best help communities that are engaged in trying to take care of their communities and seeing that they're healthy, and assisting them where they can with these any new regulations that may be necessary to regulate the e-cigarettes. It confuses enforcement, particularly when it comes to actually determining, whether or not they're using a cigarette or an e-cigarette. And hopefully this is a quick fad that dies away.
And we have details tonight on a lawsuit that you'll only see here on Action News.
Obviously, they have not done what needs to be done to protect the public.
You just gotta let the police.
Well, they are peaking in popularity, but are they sagging in safety? An explosive local lawsuit could light up the e-cigarette industry. It all started with a fire at a Clovis school.
Action News reporter Corin Hoggard is live in the newsroom now with a dangerous discovery leading to a court showdown. Corin?
Morning, Graciela. It was quite a shock for students and teachers when a Clovis East senior caught fire in the middle of class a couple months ago. But explosions and fires from e-cigarettes are no surprise at all to the industry or the federal government. I want to warn you, some of the images in this story are disturbing. Second and third degree burns will linger for a lifetime on this 17-year-old. Burned so bad, we don't want to let you see the full extent. The boy says he was just sitting in class when an e-cigarette in his pocket exploded and caught fire.
He's got pretty serious burns on his hand as he tries to reach into his pocket to pull the cigarette out, and on his leg. It burnt straight through his pants.
E-cigarettes are sometimes billed as a safer alternative to real cigarettes, reducing the exposure to cancer-causing chemicals. And while the science is still out on whether that's true, there's no doubt e-cigs pose a different kind of danger. A 2014 report from the Federal Emergency Management Agency discussed fires and explosions they can cause.
The FEMA report goes so far as to say that these cigarettes, because of the lithium-ion batteries that are used in them, have the tendency to become like flaming rockets when the battery fails.
Unlike our phones, e-cigs have a heating element, so the fire danger is higher and the batteries can explode, as we saw in video from a Kentucky gas station just this week. The boy says this is almost exactly what happened to him. That problem was spotted as far back as 2009, and his lawsuit claims the Chinese manufacturers have redesigned the smoke product, but without making it safer or even adding a warning. ABC 30 legal analyst Tony Capozzi says the lawsuit could have national implications.
If the entire industry knows about this defect and they're not doing anything about it, whatever happens in this lawsuit is going to carry across the country.
The e-cig manufacturer did not respond to my request for comment. Clovis Unified administrators are well aware of the explosive situation. They say students are not allowed to have e-cigs on campus, but since the boy kept it in his clothes, nobody noticed until it caught fire. From the newsroom, Corin Hoggard, ABC 30, Action News.
So a couple of these points were hit on, but I'm going to say them anyway, because I can. A lot of people talked about the risk of smoking and smoke being an irritating health risk. And I know I've said this before, but it really is the fire risk too. And that's what's really, really driving this for me. When I was in my first year of law school, my apartment burned down because the guy who lived next to me fell asleep with a cigarette. And at 4 o'clock in the morning, my apartment burned down. Now, luckily, by some stroke of good luck, I happened to be up here because I had a big test coming that Monday, so I was studying at my mom's house and sleeping up here in Mill Valley. When we returned to my apartment, the entire wall of my daughter's bedroom was burnt, and her entire bed had caught fire. She was 4 years old, so if that had happened when we were home, likely she would have been injured, if not worse. I think the fire risk, as they said, is very real. There have been a lot of fatalities. So this isn't just people who should shut their windows and not let smoke in. We're actually talking about life or death. I think 5 people came out tonight and opposed the smoking ordinance. Like I said, we did a lot of public input. There was 25 comments at least in favor of it. And there's also 14,000 people in town that we represent and in whose health and safety we're in charge of ensuring. I've also heard the argument that this is a class issue and we're discriminating against the poor by saying they can't smoke in their apartments. I don't think that this is a class issue. I will continue to maintain that it's a safety issue. But if it were one, I would see it not as telling rich people who can afford their own $1 million home in this town that they can smoke and telling poor people they can't smoke, but rather as us not telling less economically fortunate people that they have to live with smoke because they can't afford a home in this town. It's very, very difficult to afford a home here. We all know prices are through the roof, and it's not very easy to find an affordable apartment. So if your neighbor happens to smoke and we don't have this smoking ordinance, you're going to be stuck next to them. It's not easy to move. I also heard a lot about the word personal freedom here, and I would just echo that last speaker. How about the personal freedom to not live with smoke coming inside your home or not live with your life being at risk? I think there's other cities that have, here in Marin, there's 8 out of the 11 cities that have done a great job implementing this. Some of them similar ordinances, some of them the same ordinance. Obviously, it's constitutional, both under the California Constitution and the U.S. Constitution. Those other ordinances have not been challenged. So I just wanted to open it up by saying that I'm strongly in favor of passing this ordinance. There are other ways to get your medical marijuana, and there's still a fire risk from smoking marijuana and still a smoking hazard of it entering other people's homes if you're smoking marijuana. So I'm in favor of leaving that in as well.
Thank you. Carrie?
Mid-morning, we had a horrific fire that claimed the lives of 3 children, and apparently an unextinguished cigarette set the fire, and 3 children were trapped inside, and adults were able to get out, but the children were not able to get out. And the older sibling was found dead over the bodies of her 2 little siblings in the hopes of trying to save their lives and protect them from the smoke and inhalation that ultimately caused their deaths. And the firefighters from Richmond that were involved in that so rocked their community when they discovered the bodies of these 3 children, and the word got out, and there was a huge community effort to raise money for these children's funerals because they were in lower income housing, and I'll never forget that. And the last heroic efforts of really a defenseless child hoping to protect the lives of her 2 little siblings. It's a story I'll never forget. Had we had legislation, perhaps, to protect children from secondhand smoke and smoking-related fires, maybe this horrible tragedy wouldn't have occurred.
A lot of the establishments I've been in throughout this city have marketed their electronic smoking devices and other similar devices on displays that either spin, displays that are up by the point of sale, or displays that are near places and at the height of and at the same height where children and teens are often going to be found in those establishments. These are the type of things that you won't see with other traditional tobacco products like chewing tobacco or cigarettes, because those items are tightly regulated. Because electronic smoking devices are not regulated, you're not going to see those kind of controls. During enforcement periods, I myself have located electronic smoking devices that contain substances other than tobacco, primarily hash oil or honey oil. I've spoken to other officers that are dealing with the same issue, and the prevalence of electronic smoking devices, whether tobacco or marijuana, has increased considerably in the last year or so. I've spoken with and worked with school officials, also noticed an uptick in the use of electronic smoking devices and locating them on students. And the concern is that a lot of these devices are concealable and appear to be devices or items that are commonly used at a school, like pens and pencils. It's particularly troublesome for the administrators of these schools people that are enforcing the rules at the schools, because these items can be easily concealed, discarded, and passed between students.
As public health officer, it's my role to try and create an environment in which everyone can lead a healthy and happy life and a long life. And anything that represents a threat to that, I think, is important for us to think about and understand. And it's clear that e-cigarettes do represent a threat to our health as a community. I think one of the reasons the public is confused about vaping is that the marketing of vaping went so far ahead of our understanding of the harm. The science has really lagged behind the really aggressive marketing that's happened. I think it's our role in public health to educate and inform our community about the fact that vaping is not safe. We've allowed the e-cigarette industry to tell us about this product, and we have been told that these are a safe alternative to smoking. That's simply not the case. E-cigarettes are not a safe alternative to cigarettes. And we know that nicotine is one of the most addictive substances out there.
What is most helpful, I think, in the political process when you're going through this type of an issue is for a city council to be receptive to those that are vulnerable. I think that that's the role of government, is how do you help those that are in a vulnerable position that are having something pushed upon them? And so if that's a philosophy of a city council, it's easy to then take that same philosophy and transfer it over to someone that's vulnerable to getting fresh air. Not put yourself in a position of somebody's tobacco smoke may not bother me personally, or in this case, e-cigarettes, the pollutants that are put out may not bother me personally. But what does it do to those that are vulnerable, those that don't perhaps have healthy lungs, perhaps very young children whose lungs are forming? So what about their right to have the best chance possible to become healthy? Put yourself in the position of someone that has asthma, someone that's terrified of air pollutants in the air, and for good reason, because they wind up with seizures that they can't control, and all they're trying to do is have the best shot at getting a dose of healthy air that's not polluted in any way. And I think that the e-cigarettes, I think there is proof out there that there are very harmful, minute, minuscule effects to the air particulate matter. But those are the type of issues that may very well damage young lungs, and as I understand it, can be inhaled very deeply into the respiratory system and be piercing and do the most damage. Now, if I'm wrong, then I'm wrong. But if I'm wrong, at least I'm wrong on the side of erring to do no harm. And that's an easy area to be wrong. What happens if I'm wrong on the side of permitting something that I could have prevented that would have made our community more healthy? And it wraps up in the same kind of concept of you have a police department because you have public safety. You have a fire department because you have public safety. We have areas that deal with clean air. There's nothing more that weighs upon public health than having the right to good nutrition and obviously clean air. So again, to me, it was an easy decision if you just have core values and you follow those core values to do the most for public health and public safety and public good, and you make your decision accordingly.
My name is Lori Bremner. I volunteer for the American Cancer Society Cancer Action Network. I'm a parent, I'm a cancer advocate, I'm a cancer survivor, and I lost my father to tobacco-related illness. It's been very interesting. I've been going to a lot of city council meetings and county supervisors meetings in my area regarding electronic smoking devices. And the rooms are often very full, but they're not full of community members. They're full of people from other counties, other parts of the state. There's people from the corporate offices of well-known convenience stores who fly in from out of state and hand scripts to family members of store owners who come in and talk, not from their heart and not about the community, but what they've been told to say to protect businesses. They think to protect businesses. So the people who are speaking and taking a lot of time at these city council meetings really don't live in the community. They're really not personally going to be affected by the passing or not passing of these laws. And I really appreciate those city councils and county supervisors who are listening to their communities and thinking about public health and the good of their communities. As a citizen, I look to my local leaders to protect public health. It's very difficult to pass tobacco-related laws at the federal level or at the state level because the tobacco companies throw tens of millions of dollars into those campaigns and into those elections to fight every piece of meaningful legislation that our lawmakers try to pass. But tobacco companies can't really fight us at the local level. They can't be in every city council chamber. They can't be in every county supervisor's board. And those officials, I mean, I see you at the grocery store. Our kids play soccer together. I know you're going to look out for the good of my family, and I appreciate you for doing that.
I can tell you in my 30-plus years experience with people who have been fighting with nicotine addiction is that none of them ever planned on becoming addicted to nicotine.
I have a slight asthma problem, fortunately not as bad as some. But when a neighbor in the dorms at the UC started to vape in the hallways and right by my doorway, it started to agitate my lungs, and I didn't quite breathe as easy as I normally did. Having to breathe other toxins, in addition to just the typical air we breathe and the pollution therein, makes it more difficult to breathe. The chest feels a little bit heavier, and you don't get quite as deep a breaths, and the term short of breath is coined therein. If he wants to do these things to his body, he can do them in an environment that doesn't include the public. And in a dormitory, you include the public when you choose to smoke or to vape in a hallway.
As a University of California researcher, and in fact throughout the University of California system, we've seen very clearly that secondhand smoke injures people. And it's a widely known fact that secondhand smoke kills people. Secondhand e-smoke, I'll call it. Now, we should not be calling this vaping because it's not vapor, it's aerosol. Breathing in the secondhand effluents from a vaping kit is dangerous as well. Chronic use tends to increase the likelihood of developing asthma, not only for the user, but for people around the user. The research community is really concerned about a number of chemicals that exist in vaping kits and that result from the use of vaping kits. We know that at least 10 of the chemicals in vaping kits are listed on the California Prop 65 list of carcinogenic chemicals, chemicals that cause cancer. Another thing about reintroducing these electronic products into places where smoking has been banned is that it signals smoking. Now, we've gotten people used to non-smoking environments, but when smokers see other people mimicking this behavior, it makes them want to pick up a cigarette. When non-smokers and kids, underage people, see people mimicking this behavior, they get curious. They want to try it. This is renormalizing smoking after so much work has gone into denormalizing this stuff and getting people to a place where they can breathe healthy, smoke-free air.
Our lungs are meant to breathe in fresh air. It's hard enough, take a walk down 4th Street or take a walk in the city and you're breathing in carbon monoxide, other people's cigarettes.
Kaiser Permanente doesn't endorse e-cigarettes for people wishing to quit smoking. They're not FDA approved. There's no long-term safety data on them. There's some early short-term data that shows they may be an airway irritant. We recommend people use FDA-approved methods, partner with their physician, take an online class or join a quit smoking class. The state hotline for both teens and adults is 1-800-QUIT-NOW.